down Shed Hut. Femur! Ah!
Hey Ethan, what seems to be the matter?
Hey Doc, I think I hurt my thigh getting hit playing football.
Have you experienced any constant pain or bruising in the area since the incident?
Yeah, it hurts a lot right on the thigh.
Okay, let's get some x-rays done. It looks like you fractured your femur, Ethan.
Oh man, that sucks. I knew it was my femur, but I never knew too much about it. Could you tell me?
Well, Ethan, if you insist. First, you should know where the femur is located and how it connects in anatomical position, and to understand how your fracture happened.
But what's the anatomical position, Doc?
Anatomical position is the universal position that is used to evaluate and describe body parts and injuries. It can be best noticed by supinated position of the hands. Your femur is a part of the appendicular skeleton, which is located on the inferior proximal portion of your body and connects the body to the rest of your legs. From the x-rays, it looks like you have a green stick fracture on the lateral side of your right femur. A green stick fracture happens when a bone bends and cracks instead of breaking into separate pieces.
Whoa, is it bad?
It's severe enough that you won't be able to play football for 4 to 6 months.
No!
It could have been worse. Had the fracture been more distal, you could have injured 4 ligaments, being the ACL, PCL, LCL, or MCL, which takes much longer to heal.
Oh, Doc, I've only heard of the ACL or MCL, because those are the most common among sports injuries.
Yes. In fact, there are many ligaments that attach to the femur, 3 of which attach from the pelvis. On the anterior surface, the iliofemoral ligament attaches the head of the femur and the lesser trochanter to the acetabellum of the pelvis. The pubofemoral ligament attaches the femoral head to the pubic bone of the pelvis. And on the posterior surface, the ischiofemoral ligament attaches the head of the femur to the ischium of the pelvis. Oh, and you also could have died if your fractured bone had punctured your femoral artery, which would have resulted in blood loss.
Oh, that would have been bad news bears, Doc.
As for your treatment, you'll need to wear a cast for 4 to 8 weeks to realign your bone. Had your fracture been displaced, meaning the bone split into 2 separate pieces, you would have needed surgery, which means you'd have to wait in line, which may take a while before you can have the operation done. So Quincy, I'm going to send you over to our registered physiotherapist who will guide you to muscle recovery once your cast comes off, because your strength, balance, and movement will be limited due to the immobilization of your legs from the cast.
Alright, thanks, Doc. I feel so much more knowledgeable now.
Let's help you up, Quincy.
Hello, Ethan. How are you feeling?
Oh, I'm hurting, Doc. Okay.
So I'm here to help you rehabilitate so you can get back to playing football as soon as possible.
Alright, that's all I want to do.
So we're going to take some CT scans, if that's okay with you.
Alright, whatever needs to be done.
Good news, Ethan. The muscle insertions of your femur did not get affected, nor did any muscles around it.
That's good to hear, but what are the muscle insertions that are attached to my femur?
Well, let me tell you. The major muscle groups that insert on the femur are the whole gluteus group, which attach to the gluteal tuberosity and the greater trochanter, which make up the biggest muscle group in the body. The adductor group is also attached to your femur from the medial side of the linea aspera, located at the posterior side of your femur.
Wow. It's very interesting. Thanks for telling me, but how can I be treated?
The major treatments that we use to get you back to normal include mobility exercises, which involve abduction, adduction, flexion, and the extension of the legs.
Thanks for having me, Doc.
Thanks for seeing. So make sure you stay consistent with your treatment, and I'll see you in 3 weeks from our rehab.
Alright, see you, Doc. Yeah, break a leg.